Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about CMS Final Rule for Inpatient Rehabilitation Facility Prospective Payment System for fiscal year 2023. Let's get started. On July 27 of 2022, the Centers for Medicare and Medicaid Services, or CMS, issued a final rule to update Medicare payment policies and rates under the Inpatient Rehabilitation Facility, or IRF Prospective Payment System, or PPS, and the IRF Quality Reporting Program, or QRP, for fiscal year 2023. CMS is publishing this final rule in accordance with the legal requirements to update Medicare payment policies for IRFs on an annual basis. For fiscal year 2023, CMS is finalizing updates to the IRF PPS payment rates based on the IRF market basket update less a productivity adjustment. CMS is also finalizing a permanent cap on year-to-year wage index decreases. In addition, CMS is codifying their IRF teaching status adjustment policy in regulation and clarifying certain teaching status adjustment policies. CMS is also finalizing a policy to expand the IRF quality data reporting requirements under the IRF Quality Reporting Program, or QRP, and summarizes comments from stakeholders on inclusion of a new Centers for Disease Control and Prevention, or CDC, digital outcome quality measure, as well as the CMS Health Equity Strategy for the IRF QRP. Now I will go over the updates to the fiscal year 2023 IRF PPS payment policies. For fiscal year 2023, CMS is updating the IRF PPS payment rates by 3.9% based on the IRF market basket update of 4.2% less a 0.3 percentage point productivity adjustment. In addition, the final rule contains an adjustment to the outlier threshold to maintain outlier payments at 3% of total payments. This adjustment will result in a 0.6 percentage point decrease in outlier payments. CMS estimates that overall IRF payments for fiscal year 2023 will increase by 3.2% or $275 million relative to payments in fiscal year 2022. Permanent cap on wage index decreases. In order to mitigate instability in IRF PPS payments due to significant wage index decreases that may affect providers in any given year, CMS is finalizing a permanent 5% cap on annual wage index decreases to smooth year-to-year changes in providers' wage index payments. IRF Teaching Status Adjustment Policy. CMS is codifying the IRF Teaching Status Adjustment Policy in regulation and clarifying certain teaching status adjustment policies. The IRF Teaching Status Adjustment adjusts payments to reflect the higher cost of teaching IRFs, similar to the IPPS Indirect Medical Education, or IME adjustment. Final rule updates to the IRF Quality Reporting Program. The IRF QRP, or Quality Reporting Program, is a pay-for-reporting program. IRFs that do not meet reporting requirements are subject to a 2.0 percentage point reduction in their annual increase factor, or AIF. CMS is finalizing one policy change and addressing two requests for information, or RFIs, related to the IRF QRP. Quality data reporting on all IRF patients regardless of payer. CMS is finalizing a policy to expand the IRF quality data reporting requirements, which currently apply to all admitted IRF patients with Medicare Part A fee-for-service, or FFS, and Medicare Part C, such that IRFs will begin collecting data on all IRF patients regardless of payer. Collecting such data on all patients admitted to IRFs will provide CMS with a more complete picture of the quality of care provided by these facilities to Medicare patients. Further, this policy will help to ensure all IRF patients are receiving the same quality of care and that provider metrics reflect performance across the spectrum of IRF patients. CMS believes that the quality of care provided in IRFs would be most accurately represented using data collected via the IRF Patient Assessment Instrument or PI on all IRF patients regardless of payer. CMS is finalizing that this expanded quality reporting requirement will take effect starting with the fiscal year 2026 IRF Quality Reporting Program, meaning that providers will need to start collecting the IRF PI assessment on all patients receiving care in an IRF regardless of payer beginning on October 1st, 2024. In the fiscal year 2023 RFPP's proposed rule, CMS also sought feedback on inclusion of the National Healthcare Safety Network or NHSN healthcare associated Clostridioides difficile infection outcome measure in the IRF Quality Reporting Program. Overarching principles for measuring equity and healthcare quality disparities across CMS quality programs. While CMS is not responding to comments on these topics in the final rule, CMS will continue to take all concerns, comments, and suggestions into consideration as the agency continues work to address and develop policies on these important topics. With regard to health equity, public input is very valuable to the continuing development of CMS's health equity quality measurement efforts and broader commitment to health equity, a key pillar of the agency's strategic vision. The CMS will use this input for future development and expansion of policies to advance health equity across the IRF Quality Reporting Program, including by supporting IRFs in their efforts to ensure equity for all of their patients and to identify opportunities for improvements in health outcomes. This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.